You want to I want to pull this out.
Hi, this is Angela from Bucks Happening, and I am here at Nurture Spa, and I'm about to introduce you to Carolyn Holdsworth, the owner of Nurture Spa, and Dr. Simone Armand. And they are going to talk to you about this amazing live event that we have going on, and we'd like to see you here till 8 o'clock. So let me just switch around. Hello.
Hey,
Go
everyone.
ahead, introduce yourself.
Hi, I'm Carolyn Holdsworth. I'm the owner of Nurture Spa here in New Hope. And with me is Dr. Armand Simone, a double board certified plastic surgeon who works at our spa from Manhattan. So good to see you.
Nice to see you all.
So glad you are here tonight.
Thank you, Miss Carolyn.
Yeah, so we have worked together for 12 years now, and it has been my honor, my privilege to get to know Dr. Simone and get to know his work, both personally and through the experience of our clients. And tonight is all about what are injections, really? I mean, everybody seems to be getting them. A lot of people have questions that they're afraid to ask. And so we wanted to just take a minute to talk to the audience and answer a couple of basic questions about fillers and Botox or Dysport and all of that. So can I just hammer a few questions
Sure,
at you?
go for it.
Okay. So people have asked me, when should I start thinking about getting a filler or getting some Botox in my forehead or my crow's feet? So what age?
You know, most patients know when they're ready for these products. We generally don't like to start too young.
Okay.
But we prefer that, you know, in patients, they start approaching their late 20s, early 30s, they begin to see changes in their skin. Mm-hmm. And at that time, if there's a issue that's created, then we can address it. We can address it with fillers, or we can address it with what we call neuromodulators, which is Botox or Dysport, which reduces lines and wrinkles, and in crow's feet and the 11s in the middle of the forehead.
Or the ones, like I have.
Or some people have only a one.
I guess that's kind of a good thing. Yeah, and it's funny because I hear Botox and Dysport kind of like we hear Coke and Pepsi.
Right.
So what's the difference between the two?
Well, they're made by two different companies, but Dysport has an earlier onset of action and a longer duration, and we find it's a more predictable product, and in my hands I find it's a more predictable product and less problems with it. But you know, Botox is a household name. Right. Dysport is not. Okay. But in my hands, it's a superior. Dysport is a superior product.
Okay. Yeah, I know. I've had great results with Dysport. That's for sure. So I know that some people, and this was somewhat my experience as well, some people have a different longevity of fillers or the Botox, the Dysport, the first time they get it. And then it doesn't maybe seem to last as long the first time, and then it lasts longer the more often that you get it. So is there a cumulative?
Well, with the fillers, which are usually hyaluronic acid, it's a gel, they also provoke a certain amount of collagen production. So after repeated uses, we find that we need less of the product less often, because there's some collagen buildup that pushes those lines out, that pushes those deformities out. The nice thing about the fillers is that they're immediate, and that what you see when you walk out of the office is what you get. And you know, and they do have a longevity, normally 8 months to a year.
That was going to be my next question, is how often should somebody be getting their Botox or getting their fillers?
Right, well, in the fillers, it's 8 months to a year usually, sometimes a year and a half. I've had patients who've held on to it for 2 years. And the Dysport, and the Botox, we're looking at 4 to 6 months.
Okay.
Yeah, you really can't expect that much more than 6 months out of it.
Okay.
Yeah.
So a comment and a question that I hear from a lot of friends is, you know, my Botox only lasts 2 months. Will mine last 4 months or 6 months? And I know in the past we've talked about the efficacy of the product. Is it fresh, or maybe that's not the right term? But what are some questions that, if they're not coming to you per se, that they should ask their plastic surgeon or their dermatologist about the product to know that it's legitimate and it's not fraudulent? Or
well, these products can be purchased overseas, and they can be purchased overseas at a reduced fee to the injector.
Okay.
And the companies will not guarantee or back these products up. They may be adulterated, they may be diluted out, they may not be potent like the products that we buy here in this country. And it's also a function of each individual injector. Sometimes instead of doing a normal dilution that you can get the expected result, it may be more diluted, so it will there's more injectable material
out of one
bottle, but each one doesn't last as long. So, you know, it's the credibility and the honesty of the injector. It's the technique that's used. All these things, you know, go into it.
Yeah.
You know, I only use products that we buy here from our distributors.
Okay.
They stand behind it. I stand behind the products. They're pure, they're unadulterated, and we use all the appropriate dilutions that are necessary.
So maybe somebody could ask their doctor, where do you buy your product?
Right.
And you know, what type of dilution ratios are you using? Because
Exactly.
I've gotten great results, and my results last a lot longer than a lot of other people that I know that don't go to you.
Right.
Not that there aren't many wonderful doctors and dermatologists, you know, out there administering legitimate product and properly diluted product, but I think it's important to ask the questions.
Well, you know, one of the things that I think we should bring up is a sense of aesthetics. That when we look at someone, sometimes someone will come to me requesting a specific treatment to a specific area, and they're really missing the boat because there's something else that really cries for help,
that you
which
see
would
on
make
their face
such a difference.
Yeah.
And so sometimes I like to help the patients understand how we look at them. A sense of aesthetics is critical here. It's just not injections on demand.
Right.
It has to be appropriate. We want patients to walk away feeling that it's been worth it to them, that the result is worth it, and we back up our results all the time. We stand by our results all the time. Nothing is without problems in this world, but for the most part, they're really problem-free. Infection rates are almost non-existent, and bad results are non-existent with these products.
I was going to say, I don't think I've ever seen any, thank goodness. Yeah, but one thing that I've always enjoyed is the very consultative nature of how you work, because I know I've seen you kind of talk people out of things or encourage them to maybe consider something that they didn't see.
Or send them away.
Or you do that a lot.
Sometimes I send them away and say, you know what, you're not ready.
Yeah, exactly, which I think is very ethical and very integrous. You don't see it all the time. So, so thank you so much for taking a look at what we're doing tonight. We're going to be here till around 8 o'clock or so. We've got rosé and champagne and snacks and a flash sale on SkinCeuticals and Dermalogica. So even if you're not looking to get a treatment tonight, please stop by. We'd love to say hello to you, let you meet Dr. Simone, and answer any questions that maybe you've been too afraid to ask. So thanks a lot, and thanks for watching. Bye.